Okay, imagine this for a second. Your child is sick, really sick, and the only doctor who can help them is a 5-hour drive away. For so many families, that's not just a thought experiment, it's their reality. But, as we're about to find out, one community came up with a pretty amazing way to use technology to close that gap.
Our story kicks off right here in rural West Virginia. And when we say rural, we're talking about beautiful country for sure, but also some seriously challenging terrain that makes getting around tough. So for a family who needs to see a pediatric specialist, what should be a simple doctor's visit, well, it turns into an all-day ordeal. Time off work, money for gas, it all adds up.
And that's the big puzzle, right? You can't exactly have these top-tier specialists driving all over the state, but you also can't expect families to make these long, exhausting trips over and over again. So what do? How do you solve that?
To really get why the solution here is so clever, you first have to understand the sheer scale of the problem they were up against. I mean, the challenges are just immense. West Virginia is the second most rural state in the entire country. You've got significant poverty affecting a lot of families, and get this, a staggering 51 out of its 55 counties are officially designated as health professional shortage areas. On top of all that, you got the mountains, making long drives not just difficult, but sometimes downright dangerous.
So, faced with this mountain of challenges, innovators at WVU Medicine Children's came up with something that was both high-tech and deeply human.
They created what's known as a hub and spoke model. It's actually a pretty simple idea. The main children's hospital acts as the central hub where all the top specialists are. Then they set up several regional clinics, the spokes, in communities all across the state. Using telehealth, they could instantly beam that expert knowledge from the hub directly to the patients at the spokes.
But listen, this is way more than just a FaceTime call. It's a really sophisticated hybrid system. Here's how a visit actually goes down. The patient goes to their local clinic. There, they're seen in person by a highly trained advanced practice provider, or APP, like a nurse practitioner. That APP does the hands-on part of the exam. Then the specialist joins on a high-def video screen. The two of them work together with the family to make a diagnosis and a plan. And the best part? The specialist can then move on to the next virtual patient, while the local APP handles all the follow-up. It's just incredibly efficient. In this image, it just captures the whole thing perfectly. You get that comfort and the hands-on care from a local provider who actually knows the community, but you also get the brain power of a world-class expert who might be hundreds of miles away. It's truly the best of both worlds.
And just look at the kind of care we're talking about. It's not just one or two things. This program covers 18 different pediatric subspecialties. We're talking cardiology, neurology, even pediatric surgery and genetics. All of it available right from a local clinic. It's amazing.
Okay, so the idea is brilliant on paper. But did it actually work in the real world? Well, the data is in, and honestly, it's mind-blowing.
Let's just start with this one number, 5.9 million. That's how many miles families didn't have to drive because of this program. That's almost 100,000 hours of saved travel time. Think about what that actually means for a family. Less money spent on gas, fewer days of missed work, and more time for kids to just be kids instead of being stuck in a car.
And the scale here is just massive. Between 2018 and 2024, we're talking nearly 22,000 patient visits. So this wasn't some small little pilot program. It grew into a core part of the state's entire healthcare system.
But what about the quality? Was the care any good? Well, the numbers here are just incredible. A combined 99% of parents who are surveyed rated the care as either excellent or good. That is a massive vote of confidence from the people who matter most.
And sometimes, a simple quote just says it all, doesn't it? It's that feeling of pure relief, the gratitude of getting the best care without that awful, grueling drive. That's the real-world impact right there.
You can actually see the story of this program and its growth. It started out steady, building trust. Then it just exploded as word got out. And now it's maintaining this really high volume, which just proves it's become this essential, trusted part of healthcare in the state.
So we know it's a huge success, but the million-dollar question is why? Why did this program work so well when other similar efforts might have failed? Well, they learned some really important lessons.
By looking at what worked versus what didn't, some clear patterns emerged. The clinics that thrived had full-time, dedicated staff. That created consistency. They were all hooked into a single electronic health record, so the specialist and the local provider were literally on the same page, in real time. The successful sites also had dedicated pediatric support and a high volume of patients, which made them stable. The sites that struggled? They had part-time staff, clunky record systems, and not enough patients to be sustainable.
So all of that gives us a blueprint, a recipe for success.
You need really good training and support for your on-site providers. A single shared health record system is absolutely non-negotiable. That hands-on exam component is a game changer. And the whole thing has to be integrated into the larger health system so it can pay for itself and make the best use of a specialist's time.
When you boil it all down, what they've created here isn't just a feel-good story from one state. It is a proven, scalable, and sustainable template that could be used anywhere to break down those geographic barriers in healthcare.
And that leaves us with one last, really powerful question to think about. We've seen how this incredible model changed the game for kids in one rural state. So, could this hybrid of high-tech and human touch be the blueprint we've been looking for to help millions more?